Hello everyone. Today, we're exploring the medication known as Apixaban, widely recognized under the brand name Eliquis. This discussion is intended for educational purposes. If you have any health-related queries or issues, it's important to consult a healthcare professional. Description: Apixaban, marketed under the brand name Eliquis, is an oral tablet classified as a factor XA inhibitor. Its main purpose is to prevent blood clots by inhibiting a specific blood clotting enzyme. Eliquis is commonly prescribed to prevent stroke and systemic embolism in patients with non-valvular atrial fibrillation. Beyond this, it's used for the treatment and prevention of deep vein thrombosis, DVT, and pulmonary embolism, PE, conditions that can lead to significant health risks. Additionally, it is indicated for the prevention of DVT and PE recurrence. The FDA first approved Eliquis in 2012, and since then, it has become a preferred option for patients requiring anticoagulation therapy. Warnings: Eliquis is not suitable for everyone. It should not be used in patients with artificial heart valves or in those with antiphospholipid syndrome, especially if they have a history of blood clots, as it may increase the risk of clotting. It is also contraindicated in patients with active pathological bleeding since it can exacerbate bleeding. Due to its anticoagulant properties, there's a heightened risk of bleeding, which can be serious and potentially lead to death. This risk is increased in individuals with certain conditions such as uncontrolled high blood pressure, stomach ulcers, or kidney problems. Before taking this medicine. Before starting Apixaban, inform your healthcare provider if you have any allergies or if you have kidney or liver disease, as these conditions may affect how Eliquis works in your body. If you're pregnant, planning to become pregnant, or breastfeeding, discuss the potential risks and benefits with your doctor. You should also inform your doctor about all the medications, supplements, and herbal products you are currently taking to avoid any adverse interactions, especially those that can increase the risk of bleeding. Patients undergoing surgery or any medical or dental procedure should inform their healthcare providers about their use of Eliquis, as it may need to be temporarily stopped. Moreover, inform your doctor if you have ever had a problem with bleeding, a stroke, or if you take any other medications that affect blood clotting. Side effects: Common side effects of Eliquis include minor bleeding, such as nosebleeds or bleeding from cuts. However, more serious side effects can occur, such as easy bruising, unusual bleeding from the gums, nose, digestive system, or urinary tract, or heavier than normal menstrual bleeding. If you experience any signs of severe bleeding, such as dizziness, weakness, confusion, or headaches, seek medical attention immediately. Other potential serious side effects include allergic reactions, with symptoms such as rash, itching, swelling of the face, lips, tongue, or throat, and difficulty breathing. Although rare, there's a risk of developing a spinal or epidural hematoma, a blood clot around the spine, when undergoing spinal puncture or receiving epidural anesthesia while on Eliquis, which could lead to long-term or permanent paralysis. Interactions: Eliquis can interact with other medications, increasing the risk of bleeding or affecting how well Eliquis or the other medications work. It's essential to discuss all your current medications with your healthcare provider, including over-the-counter drugs, vitamins, and herbal supplements. Dosage: The dosage of Eliquis depends on the specific condition being treated, the patient's kidney function, and other factors. Typically, for preventing stroke and systemic embolism in patients with non-valvular atrial fibrillation, the recommended dose is 5 mg taken twice daily. Dosage adjustments may be necessary for patients with certain kidney conditions or other factors. Always follow your healthcare provider's instructions regarding the dosage and duration of treatment with Eliquis. Avoid: While taking Eliquis, it's important to avoid activities that have a high risk of causing injury or bleeding. Also, certain medications and supplements can increase the risk of bleeding when taken with Eliquis, so be sure to consult your doctor before starting any new medication. FAQ: A common question about Eliquis is regarding dietary restrictions. Unlike some other anticoagulants, there are no specific dietary restrictions with Eliquis, but it's always a good idea to maintain a balanced diet and discuss any concerns with your healthcare provider. Closing: This concludes our overview of Apixaban, or Eliquis. Remember, this information is for educational purposes only and is not a substitute for professional medical advice. Always consult with a healthcare provider for any questions or concerns you may have. Thank you for joining us today.